so much. And just to congratulate Darren and the HRB team on having, I suppose, the foresight to have a whole design thinking approach to your conference, because it is all about the user, and Sláintecare is all about the user and improving the experience of the user. And to congratulate everybody in the room for having, I suppose, the intelligence and the innovation that you portrayed today. So just for the next little while, I'm going to talk about the implementation of Sláintecare, and to say that one thing that David mentioned this morning, which I suppose is really key and which underpins all of the pieces of the implementation, is the necessity to go from observation to intervention to evaluation. And I took his 3 words very seriously there, because we can observe, and that's all great research. We can intervene, and that's all about implementation, and I suppose that's the approach I'm going to discuss with you today. But we need to evaluate what we're doing and make sure that the outcomes and outturns are relevant and appropriate. So just to give a quick background, we know that over the next 10 years our population will change radically, and our health service must change with it. We're growing from 4.6 million people to 5.2, so 600,000 people more over 10 years. And you all know the rising population projections, but it is pause for thought that there'll be more people over 65 than under 14 in 10 years' time, and that really is gives you pause for thought as the heavier users of the health service. It means the health needs are changing. We know life expectancy is up, more chronic disease and more comorbidity, and that means more demand on all of our services. And data like this highlights how valuable health research is. It effectively underpins service improvements, policy and planning, and informs our future health service delivery. And as I say, that is going to underpin the whole approach that we're going to take to Sláintecare. And Sláintecare has been designed to create a modern, responsive health and social care service which meets the changing needs of Ireland's population. And I think you know the background, and to acknowledge the work that the Trinity people who are in the room had in bringing together what was an amazing result, I think, to have an all-party Oireachtas committee agreeing on the future of healthcare in Ireland, which is the first document up here. The second one is the implementation strategy that was undertaken before I came on board in September. And the third is my action plan is translating that into reality for today. I'm going to cover that. And the goal, obviously, is to enable the right care, right place, right time, given by the right team, and I should add, at the right cost and the right value. So how will it be delivered? Transformation, as we know, depends on several things, including the resources that are needed, but critically, it needs the right mindset, guiding coalition, shared vision, ambition, clear priorities, urgency, capacity to learn rapidly, and collaboration. So I think in the burning platform that was created by the backdrop information there, we have the clear necessity to do something urgently about the situation we're in. We have a shared vision through the Oireachtas report, and now we need to implement. And that's the second part of the coin, which is effective performance management. And as the introduction said, my background is as a project manager, and what I see is the necessity to actually break down all the tasks, assign all the responsibilities, and make sure that we have clear management against trajectory, capacity to intervene where necessary, and methods of recognising success. So classic programmatic breaking down implementation approach to the strategy that has been outlined. So the approach of my office is to establish the programme of reform, to develop a strategic and programmatic approach to implementation, to ensure all parts of the system are following the strategy, collecting or collaboratively working with stakeholders, supporting work of colleagues, reporting progress. So the first part is effectively my job description, and the last piece is my absolute insistence that we are not duplicating effort, because we're not the people who are implementing all of the health services across the system, nor are we the people who are undertaking the research and data. That is, expertise is there already, but we are there to help and make sure that everybody's on the same page and heading in the same direction. So we've devised a whole system framework which looks at citizen engagement and empowerment, corporate and clinical governance, population health planning, service redesign, infrastructure and e-health to support the service redesign based on the needs of the population, who's delivering in terms of public and private sector partners, what's the workforce planning and capacity building that's necessary, and very interested in the research being done in the doctors that we heard about earlier. Funding and eligibility on the path towards universal entitlement, and accountability and value for money. And it's all underpinned by, as I say, the programmatic approach. So I've devised 4 work streams which encompass all of these different actions that need to take place that have been designed. So service design and supporting infrastructure, coordinated governance and value for money, teams of the future, and sharing progress. And don't get a fright at the next slide, because this shows the detailed work programs that are in behind each of those 4 work streams. So we have work stream 1, 2, 3, 4 in the coloured bubbles on top. And behind each of those are work programs. And I'm afraid that behind each work program is a series of projects. So we've had to break it down. You know, there's no point in having a fabulous strategy if you don't know where it's all going to join up and how it's all going to be delivered. So that's what we've been doing since I came in September. So you'll see that, and I didn't do this because of the audience here today, but the first, under Workstream 1.1, we have data research and evaluation programme. And my colleague Teresa Maguire is here, and she and her colleagues in the department, and indeed in the HSE, and indeed in the wider research community, will be deeply involved in that work programme. 1.2, population-based planning, service redesign. We have capital planning programme and e-health. And behind each of those is a range of activities. Some are more developed than others. So for instance, there's a well-publicised e-health strategy which talks about the EHR and the IHI and etc. And there's a published capital planning programme, but the service redesign and moving the care into the community is less figured out, and that's the one where we'll be concentrating most based on the population planning needs that are there. So in Workstream 2, we have the geo-alignment and regional integrated care organisations which will be coming in. We have corporate and clinic governance, public and private partners, financing and eligibility and entitlement. Under Workstream 3, we have workforce planning, training pipeline and new ways of training, culture change and new ways of working, innovation capacity building and future intelligence. And under the final workstream, we have citizen and staff engagement, the implementation office, evaluation framework. We have an integration fund which is going to support integration efforts that are aligned to the service redesign programme. And then we have communications and reporting success. So just for the next few slides, next 4 slides, I'm just going to say what we're working on, take a couple of highlights out of what we're doing in 2019. So under Workstream 1, we'll be developing a national framework for models of care, rolling out the Healthy Ireland programme with a focus on prevention, improving management of chronic disease and older people's services in the right location. Again, all of the information that you've been thinking about and focusing on today, and some of the ideas, is all about this big bubble of chronic disease and the necessity to help people to live longer and more healthily in their own communities is the real challenge that we have. We'll be commencing planning for an additional 2,600 acute beds and 13,000 community beds. So that was part of the capacity review that was launched last July. And prototyping a citizen health portal, continuing the EHR rollout and exploring the scale-up of telehealth solutions. Our focus for Workstream 2 will be to model various scenarios to develop a roadmap and policy proposals towards universal entitlement, considering recommendations from the De Butler report, which is examining the removal of private practice from public acute hospitals, agreeing a new organisation and operational structure for the future reconfigured health services. So there's going to be a review of the role of the Department of Health, the HSE and the regional integrated care organisations, and also the community health networks, which will focus and function under the regional integrated care organisations. And we'll be piloting 9 community health networks across the country in order to test and see how those models work. Because critically, I suppose, the relationship between GP, the community health services and the hospitals is so important if we're going to get integrated care to work effectively. And another really important one for us is the conclusion of the GP contract, which is in negotiation at the moment. The third work stream, implementing the workforce planning framework with a focus on engaging with education sector and training bodies, looking at new ways of training multidisciplinary teams, which I think is something we're really going to need to look at in a creative way. And supporting staff to work to the full scope of their licence to ensure patients are seen at the lowest level of complexity possible. And there are others as well, but these are two big ones. And finally, on sharing progress, we've a citizen and staff engagement and empowerment programme has started under Dr. Groiny Healy, who led on the Yes Equality campaign. We're developing an evaluation and framework for Sláintecare. We're establishing the Sláintecare Integration Fund, which I spoke about earlier. We have €20 million to scale up and test and pilot new ideas. And then to launch a programme for promoting good practice so that successful projects can be recognised and scaled. So we'll be talking to the table who had the ideas about promoting good news and how that might work. So thank you so much. We're going to do this in partnership, and that's critical. Excuse me. Partnership with citizens, with the staff and delivery partners, with elected representatives is a really important one for us, because the thing that has, I suppose, bedeviled other healthcare reform programmes and projects is that there has been changes of government and there hasn't been the continuity. So it's really important to us that the elected representatives are kept, in the room and on board and fully supportive of Sláintecare. I think to do that we need the support of citizens, and to do that we need the support of staff and delivery. So it's all part of a chain. And then I think what was really interesting about this morning's conversation was the absolute recognition that health is not simply what comes into hospitals or what comes into the GPs, etc. It's the impact of housing, air quality, food, water, mental health, environment on all of our citizens. So I think what we're very, very interested in doing is working in partnership with people who are in that agenda, in those various agendas, so not just within the Department of Health, but across the other agencies and departments as well. We all know implementation isn't easy. Success, when you look back, if something works, everyone goes, oh yeah, that was easy, that was obvious, that was, that was always going to happen. But it's much more messy. I mean, success is way more messy than that. And it needs all the people working together and all the people heading in the same direction. As somebody said, what's the barrier to implementation? It's usually two-legged problems. People, whether people are willing to go with things, whether they're willing to embrace, and whether they're willing to work together. So that's really what it's all about in my experience. I do believe that Sláintecare provides an opportunity to engage and empower leaders within the delivery system at every level, and working with the staff who have the ideas through the existing structures is going to be something that we're going to be actively promoting. And finally, I think it's a real opportunity to engage and empower citizens. I think for too long people haven't been, fully engaged in their own health and well-being, and I think finding ways to make that happen is really critical to the success of Sláintecare. So I would like to thank you for your attention, and I really do look forward to collaborating with HRB and other researchers in all of the efforts that we do under Sláintecare, because if we don't have proper research and data, we're not going to be able to evaluate what the impact of all of the work is going to be. So thanks very much for listening.